Hello, everyone. I'm Noor Mardam, Communications Associate at Mentor Arabia, host of ISSUP Lebanon chapter. First of all, I would like to thank you for joining us. We are pleased to have Dr. Farid Talih with us in today's webinar on Neurobiology of Addiction. Farid Talih is an Associate Professor of Psychiatry at the American University of Beirut. He joined the AUB Medical School and graduated in 2011. After medical school, Dr. Talih joined the Cleveland Clinic in the US and completed his residency training in psychiatry. Afterwards, he completed more specialized training in sleep disorders and addiction medicine. Dr. Talih is American board certified in psychiatry, sleep medicine, and addiction medicine. His interests include innovation in psychiatry and research in sleep and addiction, as well as burnout in healthcare professionals. Dr. Talih is published in peer-reviewed international scientific journals. He is the director of the Psychiatry Medical Education Program, the Psychiatry Inpatient Unit, and the Substance Abuse Program at the Psychiatry Department at AUBMC. In this webinar, we will learn about the basics of the neurobiology of addiction, the mechanisms of action of common substances of abuse, and the clinical implications of addiction neurobiology. We will have a Q&A session at the end of the webinar, so please submit your questions in the questions box. Dr. Farid, the floor is yours.
Thank you, Noor, for this kind presentation, and I'm very excited to be speaking today, and I would like to thank all the participants who are joining us, and I look forward to having an interesting discussion with our attendees. As you already know, the discussion will focus on the basics of addiction science, focusing on neurobiology, how does addiction happen, what happens to the brain in addiction, and how do specific substances affect the brain neurobiology, and how this has clinical implications and affects our treatment choices and prognosis for these patients and individuals. Honestly, we prefer not to use the term substance use disorders, and we are moving away from the term addiction. Addiction is really a disease state, and we hopefully like to catch and treat people before they reach addiction. But the picture is quite complex. There is an interaction between genes and biology, the environment, the actual substance or drug, repeated exposure to the brain. You see there are multiple arrows from drug to brain. Eventually, with repeated chronic brain changes from the substance, the disease of addiction develops. Addiction is a maladaptive state where the brain is hijacked by a substance. The reward system of the brain, which we share with many organisms, including animals and mammals, is hijacked by substances. This can affect motivation, memory, and other circuitry in the brain. Alcohol results in millions of deaths each year. Smoking kills many millions, up to at least 5 million every year. Almost 30 million people have drug use disorders, and around 10 million people are injecting drugs globally. There are many substances that can be abused, and we are dealing with a large family now of substances that range from alcohol all the way to narcotics and recreational drugs, and drugs that are being introduced synthetically, and brand new drugs that we are not aware of. For example, one of them is Salvia, which is becoming more common. We'll discuss it later. And finally, if you look at the last column, last line, we have behavioral addictions, which are also becoming problematic, and they seem to have the same effect on the brain like other substances. These include behavioral addictions such as gambling, gaming, pornography. The most common substances are alcohol. Around 100 million globally have alcohol-related dependence. Cannabis, around 20 million, and opiate dependence, 20 million. These are at least these are, I think, lower estimates, but these are people who have a disorder, not just using. So the users are much, much more. The earlier the exposure to a substance, the more likelihood of addiction. And if you look at this graph, addiction does not start suddenly at age 45 or 50. It's a process that usually starts in adolescence, late teens, and then takes off and then becomes a problem several decades after initial use. That's why prevention is very important. The limbic system is the primitive part of the brain. It's the part of the brain that we share with the animals. It is responsible for pleasure, for fear, for survival. This part of the brain is what's affected with substance abuse. And drugs and alcohol activate the reward system, right, in an artificial way. And there are two parts of the brain which are very, very associated with addiction: the nucleus accumbens and the ventral tegmental area. They mainly produce dopamine and serotonin, which causes euphoria and pleasure, and then disrupts the natural functioning of the brain. The little red circle on each side of the brain, this is a frontal picture of the brain, is the nucleus accumbens. Okay, if you stimulate this area directly, we can do this in animals in the lab. You put a little electrical wire inside the rat's brain, this area, they experience behaviors of euphoria and happiness like they are using drugs. If you blow up this area and you look very, very closely, and this is a little bit too complex, we won't stay too much on it, you see that there's a blue circle and a pink circle. These are the two main areas I mentioned. Most drugs, you see the lists, amphetamines, cocaine, cannabis, work on these areas. So including nicotine, alcohol, most of the substances known to man work on these two little areas, and these two areas communicate directly. Okay, the natural reward system of the brain is triggered by water, food, sex, and social interactions. But that natural stimulus becomes not adequate when you are used to the powerful stimulation from other substances. Very briefly, the natural reward for the brain is usually in animals, food, and sex. It increases dopamine. Dopamine goes up 150 to 100 times when you engage in eating or in sex. That's why we do these things. We are designed to do this to ensure survival behaviors. So if you don't eat and you don't have sex, the organism or animal or humans, they stop existing. So all pleasure in the brain is eventually mediated by dopamine, natural brain chemical causing euphoria. But if you look at drugs, if you take amphetamines, for example, amphetamines increase dopamine 1,000 times. So if you take amphetamines, the feeling is 5 times more pleasurable than having sexual relations or than eating. And nicotine is 250 times from cigarettes. So you see how people then stop doing everything else and they just want to take the substance, because nothing is going to make you have that high level of dopamine. In terms of behavior, who are people who are vulnerable for addiction? People who have impulsive personalities, people who like novelty and thrills, people who have low dopamine states, like somebody might have low insulin states and have diabetes. So this is the medical part of the issue, where some people have low dopamine. Clinically, this can manifest as having conduct disorder, mood disorders, and ADD, ADHD. We all know that kids with ADD are at a very high risk of substance abuse. Using any substance is risky. The problem is because we cannot predict how our genetics and how our brain will be affected by this substance. And some changes that can happen, especially in young brains, can be irreversible. Again, looking at the brain, the gray part in the frontal cortex, this is usually what tells us what to do and what not to do. And actually, this part of the brain is what makes us distinct from other organisms, such as the mammals, the cats and dogs. And when you become dependent on a drug, this part, it doesn't work anymore, and it's replaced by this. This part of the brain takes over, and this is what we share with the other organisms. And this is why People who are addicted to drugs can become impulsive and sometimes have unusual or disruptive behaviors. Again, looking at the brain, these are brain scans. We're not going to go into technical stuff. The first column is people who don't take drugs. And you see the red orange part means you have lots of dopamine. The second column is addicts, and you see the red part goes away. And the first line is cocaine, second line amphetamines, alcohol, and heroin. So your brain becomes dependent on the substance to make dopamine. And there's no dopamine, your brain gets turned off. And this is why people, when they stop using, they feel bad. This is a very interesting experiment. I'll talk about it briefly. They got people who never used any drugs, and they gave them a stimulant like cocaine. And then they asked the people who liked the feeling and who did not like the feeling. And they separated them into groups, and they looked at their brains. The people who did not like it, they did not care when they took the drug, they didn't feel anything. They had a very strong dopamine system. The people who liked it, it turned out they had low dopamine. You see there's less red in their picture here. So this tells you that some people are at the biological risk of becoming addicts. So if you have a strong system of dopamine, which is natural, this is something you are born with, you are able maybe to not become an addict. But people who have low dopamine can become addicts, and this can be used to help understand these behaviors have a biological cause and reason, not just behavioral or willpower or such things, or morals. We're going to skip this slide. One concept I would like to talk about, and probably this is the last picture like this, is the problem in treating addiction is relapse. People relapse. They stop for a month, they go back. They stop for 2 months, they go back. And this frustrates counselors, therapists, and doctors, and the families, that you keep on going back, you keep on going back. This picture shows you that if you stop using, it will take 1 year at least for your brain to go back to normal dopamine levels. So the first line, the first picture of the brain with the red part is normal. The middle picture is somebody who's been using. And for the user to become like he never used, his brain goes back to normal, it takes around 12 to 14 months. So we have to support these people a lot intensively in the first year, or they will relapse. And this is also helps us understand why these people are doing this. There's something in their brain pushing them to use the drug to get dopamine. And I think this knowledge helps us understand addicts' behavior and understand it in a way that is not judgmental or stigmatizing, that they are weak and they have no willpower and they like to use drugs. Having said that, it's very important to advise young people not to use drugs because the brain is not fully developed until age 21. And if you expose yourself to drugs before age 21, you might disrupt your brain development. This is a picture of the brain, how it develops. The more green you have, the undeveloped you are, and the more blue you have, the brain is mature. So you see until age 19, 20, there's still lots of brain development going on. And this is why it's best to avoid any substance use until you become a mature adult. Why do people use drugs in the first place? When you survey young people, most of them say it is either to have new feelings or to reduce bad feelings, anxiety, worry, fears, and depression. However, we know that there is a bidirectional relationship between addiction and psychiatric disorders. Psychiatric disorders cause substance use disorders, and substance use disorders also cause psychiatric disorders. And people with serious addiction problems, especially at a young age, up to 75% of them have a psychiatric disorder. And it's very important to examine and treat the psychiatric disorder. If you do not treat the psychiatric disorder, the addiction will come back. And this is a very important concept. If you look at the drugs we have, we like in psychiatry this graph, the dependence versus harm, how addictive a substance is and how physically dangerous it is. Because some substances are not physically dangerous, let's say like cannabis, but some substances are very addictive and very physically dangerous. So the worst would be on this graph, things like heroin and cocaine, okay? So this also is important for educational purposes for people dealing with substances, because there's so many substances. I'm sure some of these things might sound unfamiliar, but these are the things people are using. So again, the major groups of substances are alcohol and sedatives. They can include the sedatives which are taken as tablets or alcohol, painkillers, stimulants, amphetamines and cocaine, recreational drugs, which are very popular now among young people, MDMA, ketamine, ecstasy, THC, and all its derivatives, cannabis, marijuana, and a problem now which is called synthetic cannabis. It's not natural, it's made in a lab, and the synthetic cannabis is very powerful and does not show on drug testing. So some people are using it. Nicotine is a very dangerous and powerful drug. It doesn't matter if it's water pipe, a cigarette, or e-cigarette. And caffeine, we forget about caffeine because it's socially acceptable and the doctors use it a lot, so it's okay. Caffeine is one of the most powerful substances being used. We'll discuss it more later. And there's some things that kids use, inhalants. They snuff or inhale it or smell it. They could be glue, paints, and such things. These are actually very dangerous. And there are some herbal things like salvia and ayahuasca and mushrooms and such things. Okay, we will discuss them also later. Another major problem is that addiction now is polysubstance. If you look at this, I know it has lots of information. I hope you can see it well. We don't have people now using one substance. People, especially young people, are using a combination of marijuana, cannabis, alcohol, stimulants, amphetamines, pills. Many people are drinking alcohol and cannabis. So there is a very complex picture. People are taking drugs from their parents, they take their grandmother's painkillers, they take their aunt's sleeping pills, and they're mixing them with alcohol. So this also complicates the picture and puts them at physical harm and risk. We will now talk about the different substances. Cannabis is one of the most commonly used substances globally. The cannabis plant, which you see here, it grows in many places. Usually people develop two substances. Either the plant is dried and usually called marijuana and smoked, or in some countries, like in Lebanon, for example, people produce hashish. They ferment the plants and then they take the resin and it becomes like this. I don't know, some people in the audience might be parents or teachers, and it's important sometimes to know how these things look, okay? Why do people like to smoke cannabis? Cannabis causes euphoria and relaxation, feeling good and relaxed. However, it can impair memory if you smoke large amounts. It can also cause concentration problems. It can slow people down. In some people who are at risk, they can develop paranoia or panic. And there is something called loss of motivation or amotivation syndrome, where some people stop getting interested in other things. And as psychiatrists, what we worry about with cannabis, especially that now it's being legalized in many places, is that it can increase the risk of serious psychiatric problems, specifically depression and schizophrenia. Schizophrenia is a dangerous medical psychiatric brain disease that is really very severe and disabling, and we don't even have specific cures for schizophrenia. What are the physical effects of cannabis? Fast heart rate, dizziness, dry mouth, red eyes, appetite changes, and weight gain. People become hungry. And this sometimes can trigger panic in people who use cannabis. And something that's interesting, we find now that, especially in young men, it can affect their sex drive and reduce testosterone. Is cannabis addictive? This is a big question and debate, but at the end of the day, the answer is yes. To be transparent, we have to give full information. Cannabis is not highly addictive, but the addiction rate of cannabis is around 10%. So if you have 100 teenagers smoking cannabis, 10 of them will continue to smoke cannabis and they will not stop. and they will smoke more and more. And when they start smoking on a regular basis, they can develop the mental problems we talked about. Okay. Cannabis works on a receptor in the brain called CB1, and it also can affect your body too. It increases dopamine and increases GABA, which is a sedative. Like if somebody takes a Xanax tablet, your GABA goes up. So cannabis can do that also. Cannabis withdrawal is now listed in DSM-5. And when you stop smoking cannabis, you can have insomnia, irritability, and poor appetite. And this is evidence that cannabis is addictive. So it's not just a psychological dependence. There is a physical dependence. Chronic cannabis use can lead to schizophrenia. And the risk is that this is complex. I'm just going to describe it very briefly. It shows you that people who have a certain gene are at risk of having schizophrenia. So it's true that some people smoke cannabis and nothing happens to them. But there are some people, if you have a specific gene called COM gene that is genetically in a certain way, you have a much, much higher risk, the green column, to get psychosis. And we don't know what your genes are like. So this is why experimenting with cannabis can lead to dangerous consequences in some people. So the best approach is to avoid experimenting, because we do not know if you have this gene or not. One clue is if you have family members. I tell people, if you have an uncle or a cousin who has schizophrenia or they have bipolar, you probably don't want to take a chance and smoke cannabis because you might have the gene. And this is what I mentioned earlier, synthetic cannabis. It's called K2 and spice. This is found all over the world. These are very powerful cannabis-like substances made in labs, and they are also triggering many physical side effects, and they can be dangerous. This is a relatively new herb that's being used a lot in many countries, and in many countries it's actually still legal. It's a plant. It grows in South America. It's called Salvia. Usually the leaves are collected and dried, and it looks a little bit like cannabis, and it's smoked. But it works in a very different way. It causes behaviors and feelings similar to having hallucinations, like somebody who takes LSD or something like that. It works in a very unusual way. Young people think it's safe, and it's not detected on drug testing. So many kids, when their parents are testing them for drugs, they are using it now because it doesn't show. Okay, it can cause psychosis and is also addictive. This is briefly the poppy plant. This is the ripe poppy plant in which all opiates, substances, morphine, heroin, codeine are derived. This whitish liquid is dried and processed and becomes different substances. It can be, it's a grayish powder. It can be injected or smoked. And now, of course, we have, it can be in tablet forms if it's tramadol or painkillers. Opiates are the most dangerous of all the drugs. They can cause death from a single use by blocking breathing and the heart, because they work on the brain's breathing and heart rate control centers, and they can shut them down and people can stop breathing and die. And this causes a sudden death. There's also medical risks from injections, because people inject frequently, and that can cause HIV, hepatitis, and other problems. And the problem is with stopping. The brain becomes very rapidly dependent on these substances, and any rapid stopping will cause severe withdrawal, and people will continue to use because they don't want to get sick. They will have stomach aches, vomiting, diarrhea, sweating, tremors, shaking, loss of appetite. They become very, very ill. So they are afraid to stop. And this is why detox has to be done in the hospital, or specific medications that can make it better for them. Okay, it's very unlikely that somebody's going to stop taking this on their own. I like to show this picture to remind ourselves that heroin is a medicine, and heroin is a brand name owned by the same people who invented aspirin. So it tells you how knowledge changes, and we have to always be careful. And I use this example when I talk about cannabis. Now everybody is normalizing and legalizing, but then we might end up with problems because heroin was a medicine you could buy. And it turned out to be a very addictive and dangerous painkiller. And this is not too long ago. This is maybe like around 1920s. This innocent looking plant is not very innocent. This is the tree that grows in South America and produces coca leaves, which produce cocaine. So the leaves are collected and processed, and a whitish powder is developed. Sometimes the powder is transformed into a little crystal, which is called crack cocaine. And the difference is the powder is usually inhaled in the nose, the other one is usually heated and smoked. Cocaine also is a very dangerous substance because it increases adrenaline and dopamine in your system to very high levels very quickly. This is why people take it because they like that feeling, but that can cause very serious heart disease problems, stroke, heart attacks, and some people die when they use it. Cocaine and alcohol together is very toxic. Cocaine can cause violence, aggression, and paranoia, and also damage to your nose and sinuses. We see that a lot. I'm just checking everything's okay because I had a pop-up on my screen. Okay, so again, same story. Cocaine was a medicine, and cocaine up to, you can see this date at the bottom, up to 1885 you could buy cocaine, and they were giving cocaine for children. Cocaine works also as a anesthesia agent, so they would put cocaine drops on the teeth and the pain would stop, and these children probably would become hyperactive or something. So, and it was very cheap, 15 cents. And the original Coca-Cola drink had cocaine in it. That's why it has the name Coca, because coca leaves are where we get cocaine from. Amphetamines, you probably all heard of amphetamines. Amphetamines are stimulants like cocaine, but they are not natural. They are synthetic, made in a lab. They're very cheap, very easy to make. They are very common in most of the developing world, and they are usually pills that people take, and they increase dopamine, and they can cause serious violence, addiction, and psychosis. There is a more powerful type called methamphetamine. And people call it crystal meth because it looks like little crystals. These are heated and smoked, and they are very dangerous. We'll briefly talk about hallucinogenics. Hallucinogenics include things people take recreationally. They could be mushrooms, and there's also LSD. They naturally occur, like the peyote cactus plant and the psilocybin mushroom. The problem is some mushrooms in nature are dangerous, so some people try to go find them. And if you are not an expert, you can get poisonous mushrooms. And there is synthetic hallucinogenic, it's called LSD. LSD causes, like the other hallucinogenics, very strong visual hallucinations. You start seeing things and hearing sounds when you are awake. And that can be very scary and traumatizing to many people, and they have panic because you cannot stop these visions, even if you close your eyes. And if you're lucky, you have maybe nice visions of maybe colors and flowers, but some people have scary or violent hallucinations that really scare them. These work by increasing serotonin levels in the brain. So they push up the serotonin levels very quickly, and this causes this phenomenon. Some people get panic when they are exposed to hallucinogens. There's also a rare phenomena where people who take LSD or magic mushrooms can have flashbacks. So you can take them, and then maybe 2 or 3 months later, the thing that you hallucinated, the visions, they come back suddenly, and they can also upset people a lot. If somebody has a mental illness and you take mushrooms or LSD, you might trigger the mental illness and become very sick. And people sometimes come to the emergency room and they need to take medications to calm down. So the mushrooms are usually dried and eaten. Many of the other hallucinogenic drugs, such as ecstasy and LSD, are marketed specifically to young people. So they are designed in ways that they appeal to children. So LSD usually is like a little liquid, and it's dipped in these little stickers. And the kids put the stickers on their tongue, and the LSD melts, and then they get the feeling of the drug effect. Okay, and you can see that they're obviously designed to appeal to children. We'll talk briefly about ecstasy because it's very common all over the world. It's called, the technical name for ecstasy is MDMA. MDMA is a combination between an amphetamine and a hallucination drug, LSD. It can cause lots of energy and lots of visions. Your taste gets different. You can taste stuff when there's nothing in your mouth. But also it's not harmless. It can cause serious problems like Parkinsonism and neurological disease. It can cause very high body temperatures. It can cause seizures, sometimes dehydration. And some people, it's rare, but some people died from taking these medications, especially if you take other medications. And if somebody's taking medicines for anything, you have to be very careful when you take these dangerous substances. MDMA is also known as the party drug, and usually young people use it in large parties called raves. There is now some controversy. Some people, psychologists and therapists, are giving MDMA to their patients and doing therapy, and it's becoming more popular now. And some of my patients are asking me, I want to try it and take it like that, but we don't really know a lot about these experiments, and the research is very little, and I don't advise people to do this approach, at least not now, because we really don't know anything about what's going on in these reports that we are getting in the media. So now we'll talk about caffeine. This is the caffeine plant, if anybody is interested how it looks. These are usually picked and roasted, and then we drink it. Obviously, we all drink coffee. Caffeine is addictive. If you drink coffee every day and you suddenly stop, you're going to feel down, you're going to feel tired, you're going to get headaches, and you're going to feel hungry. In large amounts, caffeine can be harmful. When you exceed 400 milligrams per day, it can cause anxiety, sleep problems, insomnia, and some people actually can affect their heart and kidneys. To give you an idea of what 400 milligrams per day is, a cup of strong coffee has 100 milligrams. So basically, if you are exceeding 400, is more than 4 or 5 cups a day. Women, children, and people who are elderly have more side effects of caffeine. Tobacco is probably the most addictive substance known to man, and this is actually true. Tobacco, which is really nicotine is in tobacco, causes cancer, heart disease, lung disease, and at least 5 million people die each year from effects. This is the plant. The plant is dried and then chopped up, and I'm sure everybody knows what how tobacco looks like. It's usually the first drug abused by people globally, and it is actually the gateway. Some people talk about, cannabis is the gateway drug. No, nicotine is the gateway drug. Okay, and you might be wondering who this person is. This is a trivia I like to mention. This is Mr. John Nicot, and nicotine is named after Mr. Nicot because he was a Frenchman who was traveled to North America many years ago when Europeans were exploring North America, and he found tobacco very common among the Native Americans. And Mr. Nicot liked it. He tried it and he liked it, and he made it popular. He was an ambassador, so he made it very popular back in Europe, and he traveled around Europe, and he was very essential in spreading nicotine globally. So the substance nicotine in tobacco is named after him. So that's the trivia for today. Water pipe, common in many developing nations, North Africa, Arab region, is thought to be a better option, but it's not. It is definitely not better than cigarettes, probably is more dangerous. All tobacco products cause harm. We see actually, like, there's a spread also of water pipe or argili or hookah smoking outside the Middle East region. You see it more now in North America, South America, and Europe. Part of it is the perception somewhat that it is a safer option, but it is not safer. Addiction to nicotine is very quick. You can become addicted to nicotine after 2 to 3 weeks of just trying it. And there is no substance that causes addiction so rapidly and so strongly other than nicotine. Within 2 to 3 weeks, you can become addicted. And if you become addicted, most people smoke or use nicotine for 20 to 30 years before they're able to stop. We have to talk about something which we are all facing now, which is the issue of electronic cigarettes. Heated cigarettes, IQOS and Juul, all are very addictive. They are marketed not to young people as a healthy alternative, but they are not healthy. Most people, when they get a little bit older, they start using regular cigarettes. The chemicals and toxins are dangerous. We actually are going to do some research here to study the actual chemicals and the toxins, because we don't really know much about them. We only know what the companies tell us, and they're not going to tell us everything. Juul is a new type. It's very addictive. They're being sued now in the US for targeting children specifically. They are targeting young people, and if they start smoking at 14 and 15, they're going to smoke until they are 50 and 60, and that's going to bring lots of money for these companies. And sometimes some of these electronic cigarettes are being used to smoke liquid cannabis. I'm going to show you some of these pictures again. For example, Juul looks like a USB stick. There's some parents and teachers, and they see it, they think it's a USB stick. They're not sure what it is. It doesn't even cause lots of smoke. Vaping causes lots of smoke and it's dangerous. And you probably all are familiar with this. And this one at the bottom, for example, is just a sample. These are very dangerous because they are specifically being marketed to children. Okay, and we're seeing them more and more in schools. And they come flavored apple and strawberry and stuff. So we're nearing the end. We're talking now more about less common things, but you should be aware of them because they can be abused. Steroids, we see lots of young men abusing steroids to become stronger athletes, to get bigger muscles. They are used illegally, injected or as pills. They cause medical problems. You can have lung disease, heart disease, many things, kidney disease. They affect testosterone, sperm counts. They can also cause hair loss and weird skin changes. But steroids are addictive, and steroids can cause physical anger and behavioral problems and violence. And this is why people who use lots of steroids, they become violent. And when they stop using the steroids, they become depressed and sad. So it's very important to monitor young men who might be very athletic as they might be using this. Sometimes it's given to them by their coaches or their friends in the gym. And this is also something of importance. It is, we see it in young teenagers and girls, people who are sniffing and inhaling solvents. It's called huffing. It could be the nitrous oxide gas, like the dentist. It's found in this girl in this picture is using a whipped cream bottle. Whipped cream that you put on cakes and stuff. It's pushed out of these bottles with a gas the kids are not eating the whipped cream. They throw out the whipped cream and then they inhale the gas, and that can cause a feeling of being high. But again, that is a very dangerous substance. And all these things can be inhaled, markers, glue, but these actually can be very dangerous. They can cause brain damage, loss of IQ, and in some people it causes seizures and heart disease. And some of the children have suffocated and died. So you have to be aware of these things, which are not common, but they are dangerous. And we're reaching the end. If you're starting to get bored, we're going to talk about alcohol, because alcohol is a very dangerous substance. It's the globally most prevalent. Historically, people have used alcohol for thousands of years, and it's the first recorded substance of abuse in ancient doctors and medicine. Some basic knowledge: people don't know a lot about alcohol, really. What is alcohol? How much alcohol is in drinks? That's also very important to educate people. A beer has maybe 5% alcohol, wine more, but if you drink hard liquor like whiskey and vodka, it can be 40% alcohol. Alcohol can be very dangerous in young people because their brains are not developed, and it can cause risky behaviors and as well the risk of addiction. Alcohol affects your nervous system directly, and it can cause lots of changes. Education is very important in societies where alcohol is socially acceptable, because many societies alcohol is acceptable. So we need to educate people about what ages, what amounts, and how to drink. And that's tricky. Many people are not aware. What are the guidelines? Okay. First of all, general knowledge is important. And what are some of the side effects? Blackouts. Blackouts are very common when you drink a lot. You see it in young people. They go out, they drink 5, 6, 7, 8, 9, 10 beers. They develop blackouts. They stop remembering and they become confused, but they are still awake. So they can like try to drive a car or do something, and they can get seriously hurt, sometimes assaulted, especially in young females. Alcohol misuse can worsen depression and anxiety and even sleep. Some people think it helps anxiety or sleep, but actually it makes it much worse. So some basic guidelines for adults: the maximum should be 1 or 2 per day, and not every day, ideally. Females have less biological tolerance for alcohol, so females should always drink less. And some Asian populations have also less biological tolerance, and they can get intoxicated or drunk very quickly. And you have to remember that alcoholism is very genetic, and it does run in families. So if you have an uncle or a cousin who is an alcoholic, you probably should be very, very careful, because you might get that alcoholism too. Finally, if we talk about the risk of addiction globally, what is the most addictive substance? Tobacco, nicotine. If people ever try to smoke, 30% will remain smokers. That's even more addictive than heroin. The rate for heroin is 23. So if you have 100 kids who smoke, 30 will continue smoking for a long time. If you have 100 kids who try heroin, 20 will continue. So cannabis, 9. So cannabis, remember, is addictive, but not as much as the other substances. And the worst and strongest addiction is from nicotine, although we tend to focus more on what we call the hard drugs. So I think this is the end of the lecture. What is treatment? Treatment is very complex. It has to be case by case, individual by individual. No two people are the same, but really it's better to focus on education, awareness, prevention, stigma reduction, and having a multidisciplinary approach so we avoid treatment. I tell people the best treatment is to avoid treatment, not to get to that point. So I hope this was an interesting lecture and what people were interested to hear about. And I'll be happy to take questions. This is a picture of people who are not familiar with the Beirut or American University. This is a picture of our campus. We are on the Mediterranean Sea. My office is somewhere inside this little park, and all of the green is our campus. So thank you for listening, and thank you for your attention.
Dr. Farid, first of all, thank you for sharing this beautiful picture of Beirut. It's actually one of my favorite locations. I would like to thank you for this informative webinar. I don't even come from a substance use, from the professional field of substance use, but I found it very interesting, and I'm sure most of the audience did. We received a lot of questions. However, we will not be able to go through all of them, but we will try our best to go through them. Dr. Talih, the first question is, can you please explain the difference between recreational used marijuana and that which is distributed to individuals versus the medical use?
Again, this is a little bit of a interesting, actually it's a very interesting question. It's also difficult to answer because it depends on many factors. It depends on cultural factors, it depends on personal preference. Medical cannabis use is restricted to basically controlling symptoms of some diseases. So most cannabis used medically is not a specific treatment for a disease. So let's say somebody's doing chemotherapy and they're having lots of vomiting and nausea, and they can't eat. It's possible that cannabis can help reduce the vomiting and increase their appetite. There are some specific cases in some type of children where cannabis extract, CBD, might help in seizures and epilepsy. But we have to be careful that many of medical cannabis is being used in a very loose way as a substitute for maybe treating conditions in a more meaningful way. So maybe if you have anxiety, maybe you should go see a therapist, psychologist, and counselor and work on the anxiety. But obviously, if you smoke cannabis, the anxiety is going to go down. But then will you be dependent on it to keep it down? Recreational cannabis use also is, we have to think about it as maybe like alcohol, where some people maybe like to use it and are going to use it, but we have to warn them that, like you warn people about alcohol, you cannot drink and drive, you cannot smoke cannabis and drive. You cannot drink every day 4 or 5 drinks. You should not smoke cannabis every day 4 or 5 times. So I find using the approach of how to use alcohol recreationally and safely maybe applies to cannabis. But again, like we said, there is risk for some people to develop mental illness, psychosis. That's why I wanted to show that a little bit more detail, that we don't know. You might want to try it recreationally, but you have the gene and get psychosis. So again, we don't know as much as we think we know about cannabis, and we have to be very open-minded and careful too.
Okay, thank you. So moving on to the next question, it's more specific. What are your experiences of working with Korsakoff Syndrome, and how do neurobiological models support our understanding of this condition?
Okay. Korsakoff Syndrome is part of a larger syndrome called Wernicke-Korsakoff, where is a disease of the brain that we see in people who are exposed to chronic alcohol use. We're talking about people who used large amounts of alcohol for many, many years. And the problem is that Korsakoff causes damage to an area in the brain called the mammillary bodies, which are the memory processing centers. They actually get destroyed by the alcohol, and they cannot be recreated. And this is a direct toxic effect of alcohol on these parts of the brain, as well as loss of specific vitamins, thiamine and folic acid. So once somebody develops Korsakoff, maybe you can, if they stop drinking and you give them specific treatments like thiamine and maybe other things that might help the brain, they might not get worse, but it is very challenging and difficult to make them get better. So unfortunately, these are degenerative brain diseases that we are not good at treating, honestly, because there are no specific treatments. It's better to prevent somebody from reaching that stage.
Okay, thank you. Dr. Talih, you mentioned in your first slide that addiction can not only be using a substance use. You mentioned that gaming can be an addiction, and we are seeing a lot of young people get into the gaming world, and you see all these esports happening all around the world. Are there any studies on gaming and addiction that you have read or experienced, and what's your input on the matter?
Non-substance, non-chemical addictions are probably going to be the addictions of the future. So we're talking about behavioral addictions that really range from gambling, pornography, electronic gaming. You can argue even maybe online shopping now.
Okay.
The problem is that we live in a digital world where exposure to electronic information and entertainment, and even what we're doing now, is the norm. So how much time are we spending? I spend most of the time now on this, and if you are not on a screen, you are on the phone. But however, if you are using it in a meaningful way, I mean, that's fine. Our kids are sitting now in front of screens, but if a specific online behavior is taking up most of your time, it is preventing you from doing other important things, and if it's affecting your mental health, not having it, then you probably do have a problem. We definitely consider electronic gaming addiction as a disorder. It is included now in the DSM-5 and is included in other guidelines. In some countries, it's officially recognized and being treated, like example, South Korea, the US. In our region, again, I think that audience is international, but in our region, we don't have lots of information. As I can tell you anecdotally, because I work in a university setting, I see many young people, and some people, yes, it is a problem. They cannot function, and they are spending 12, 14, 16 hours playing the same game online, and then they cannot do anything else. Just go sleep, wake up, they missed university, they again play again and again. So we have to treat that like we treat somebody with an addiction, and definitely it's a real thing.
Thank you. Someone's also asking, can you explain how cannabis could lower the production of testosterone?
Cannabis in the brain does many things, and we have natural receptors. That's why people like cannabis, because it seems that it has a place in the brain where it goes and works and does stuff. And it has a hormone-like effect, and it affects a hormone in the brain called prolactin. Prolactin, when it goes up, your sex hormones go down. For example, when people are breastfeeding, prolactin goes up. That's why the period stops. So you can't get pregnant and you focus on the baby. So the prolactin levels go up when people use cannabis. We're talking heavy chronic use, just trying once. So people who are smoking several cannabis cigarettes every day for many months, the hormone levels will go down and the sex drive will go down. But this is reversible. If somebody stops, it goes back to normal.
Okay. What kind of harms do an adolescent's brain are irreversible? Like, I guess,
so it depends on the amount and the exposure. So let's say somebody, unfortunately, we see cases of people getting exposed to drugs and alcohol at age 12, let's say. by the time you are 16, 17, 18, you have been using cannabis, nicotine, and alcohol, and possibly some other drugs now for 5 to 6 years. And these 5 to 6 years are the years where your brain is growing according to a design which did not expect to have these substances. So the damage we see is mostly concerning learning, concentration, and in some people who have a risk for mental health, they are developing disorders like bipolar and schizophrenia at a younger age. And sometimes we can control them and manage them, but they are not going back to what we call a normal trajectory. Okay, so they always are going to be lagging from their peers who did not use. And with intensive rehabilitation, sobriety, and close supervision and monitoring, some people are able to catch up, but some people, unfortunately, it's not possible, and they continue to suffer.
Wow. Okay. Thank you so much, Dr. Talih. I think our time is up. Thank you again for supporting ISSUP Lebanon. For our audience and the professional who are professionals in the drug use prevention field in Lebanon, please apply for a free membership on our website to stay updated with the latest information. And you can also follow us on our social media platforms, Twitter, LinkedIn, and Facebook to learn about our future activities. Dr. Farid, thank you so much again. And would you like to add anything?
Thank you again for having me, and I'd like to thank the audience for their attention and interesting questions. Again, I encourage people to always try to advocate, to reduce stigma, to try to educate, and to try to direct people to help when help is needed. I know in many situations and countries, including ours now, resources are scarce, but there's always something that can be done. And there are lots of resources out there if people look, and there always is something that can be done. So I hope everybody stays safe and sober, and I hope the information was interesting and helpful. And thanks again for arranging this, Noor.
Thank you, Dr. Talih. The webinar recording will be available also on ISSUP's website. So in case you missed the first part, in case you want to watch it later or share it, you can please go ahead and access the website. Thank you, everyone, and have a good afternoon.